In this video, I'm showing you a technique that you can use to reduce pain and tension in the lumbar spine. It's very simple and easy to do for both you and the patient. Simply sit the patient on the couch, making sure their feet are on the floor or on a stool, so when the patient flexes forwards, they can take the weight through their feet. Take an IASTM tool. Here I'm using the RockBlade, and I've put some wax over the lumbar spine. I'm going to start on the lower thoracic, moving down into the lumbar erectors and gently gliding the tool down to the back of the pelvis. As I do this, the patient has been instructed and is guided to slowly flex forwards. And it's important that they flex through the lumbar region as much as they can, as we're trying to open up this lumbar flexion movement. And to be clear, what I mean by that is we're trying to encourage the patient to flex their lumbar spine more than they normally would. And we're looking to try and desensitize this area using the tool so that afterwards the patient has more lumbar flexion available with less pain and the feeling of less stiffness. I've repositioned myself to the other side here, so I can now target the right side of the patient's lumbar region. And you can see the side we're working on is a little bit red. There's a little bit of this erythema on that side. That's why I stopped delivering the treatment on the left and came over to the right. A little bit of reddening on the skin is generally acceptable and only very transient, and it will soon fade. If you were to continue working on that side, as you can imagine, it would get more red and likely last for longer. And then you may have an unnecessary amount of erythema, and more than is required to get the benefits of the treatment. It's not usually comfortable to pass the tool down the center of the spine if you're bumping over the spinous processes, but sometimes, depending on the shape of the tool, you can come down over the back of the sacrum and perform the treatment with the patient flexing forwards as you pass the tool over the back of the sacrum. Okay, one more time. Following the treatment, the patient should be able to flex forwards with an improved lumbar curvature. Thanks for watching the Physio channel. We'll pop some other videos up on the screen here, which you may find helpful. Otherwise, we'll see you in the next video.